Welcome to Robert Wood Johnson University Hospital, Somerset's Health Talk. I'm Dr. Douglas Oshinsky of RWJBarnabas Health Medical Group's Warren Internal Medicine. We recognize that patients and families may be fearful of seeking medical care at this time. However, it is vitally important to understand that care should not be delayed if you're experiencing the signs and symptoms of a heart attack or stroke or other medical emergency. On today's show, Dr. Marc Milano, Medical Director of Robert Wood Johnson University Hospital, Somerset's Emergency Department, will share the precautions that have been taken in the emergency department to ensure your safety. We will also be joined by Laura Smith, a registered nurse who's the stroke coordinator for Robert Wood Johnson University Hospital, Somerset, who will discuss the symptoms of stroke and the importance of getting prompt care. In accordance with social distancing precautions, Dr. Milano and Laura Smith will be joining us remotely for the show. Thank you both for being here and being available via Zoom, which is a little bit different than we've done in the past. So first, for the audience, they all want to know a little bit about yourselves. Tell me about your background. So we'll start with Dr. Milano first.
Okay. Thank you, Dr. Oshinsky. My name is Marc Milano. I'm the medical director of the emergency department at Robert Wood Johnson University Hospital in Somerset. I've been there for 12 years in a leadership role for the last 5. Jersey guy, born and raised. I live in Hillsborough, and I love serving the community that I live in.
And Laura Smith, tell us a little bit about your background.
Hi, good morning, everybody. Thank you so much for having us this morning. I'm originally from Northeast Ohio. I moved here about 15 years ago, and this is my 20th year being a nurse. I've been in this role as the neuroscience program manager for the last 3.5. So the majority of my career, since I moved to New Jersey, has been involved in the neurosciences. So, I transferred over here to Somerset about 3.5 years ago, and I really love it over here. It's a great place to work.
Thank you both for a little bit of introduction on yourselves. And both of you, thank you for everything you've done during this pandemic, helping to stem the curve and allowing our patients to have the best possible care at RWJBarnabas Health Somerset Medical Center. Now, for Marc, the emergency department volumes recently have been down. Can you tell us a little bit about prior to the pandemic, during the pandemic, and now currently as we're stemming the curve, what's happening in the emergency department?
So it's a great question. Customarily, we see about 150 patients a day in our emergency department. That's sort of during normal business operations. Varies a little bit from month to month, a little busier in the winter, a little bit less busy in the summer. And we rolled into the pandemic at that usual volume, especially January tends to be one of the busiest months of the year. So we'd seen upwards of about 155 patients a day. And then February, we started to hear about coronavirus, and we were wondering just how busy it was going to be, to the extent that we actually put up a tent outside the hospital thinking we were going to have this massive surge of overflow. Well, much to our surprise, it was not volume, it was acuity that actually overtook us. And in fact, by March, our volume had begun to drop to almost 50% of our volume. So we went down to seeing somewhere in the mid-70s patients per day, although those patients were tremendously ill. And that's kind of where we are right now, although I think as we talk through this program, I'll be able to explain along with Laura as to the transition of illness severity from all COVID patients to currently many fewer COVID patients, but many, many very sick patients.
So what you're describing which is a very serious type of thing, patients basically delaying the care and delaying their coming to the emergency room. And is that what you're seeing?
Precisely. I don't want to call anything success, but I'll say it only because it makes sense to say, is that in ways we're victims of our own success. We sent a message to the public that they should stay away from the emergency department so that they wouldn't overwhelm us and so that they wouldn't get sick. And we didn't know exactly what that was going to look like. And now that we've been so overwhelmingly successful in preventing the transmission of illness within the hospital, are we comfortable to say, listen, come back, you won't get sick if you come to us. But importantly, if you have a serious medical problem, you really need to come back and see us.
And again, it's not only the emergency department, but those of us in the private sector, we also had gone to things like telehealth and not seeing people in the office. And I can tell you from my experience in the last 2 weeks, I've had two patients I've sent to the emergency room, and it's taken a half hour to convince them how you have done such a good job on keeping the pandemic under control, all the safety precautions that RWJBH Somerset Medical Center has done, that they can go to the emergency room with the acute problem, avoiding it becoming more serious and ending up with possible tragedy. So,
Yes.
can you tell the audience what safety procedures RWJBH Somerset Medical Center has instituted in the emergency room?
I'd really like to talk about the entire hospital. We've
Good.
controlled the portals of entry such that anyone coming into the hospital is screened for temperature and symptoms. You cannot get into Robert Wood Johnson University Hospital, Somerset through any portal of entry without being screened by one of our employees with a thermal scan, as well as questions regarding your recent health. So that's the first thing that we did. And we did that very early on. There's only one way to get in and out of the hospital up until this week when we started to reopen some of the essential services of the hospital. As pertains to the emergency department, number one, our entire staff is utilizing PPE, and we provide every patient that comes into the emergency department from the second they come through the door with a surgical mask to wear, again, to protect them, but also to protect patients and the rest of our staff. We are able to place patients into high or low acuity areas, where patients into areas where we have low suspicion of COVID. So we've really developed a process by which we've kept the patients safe, kept our staff safe, and be able to manage normal daily operations despite this extremely high acuity that we've seen.
Now, can you tell the audience you use the word PPE and they've heard it in the news multiple times? Can you explain to the audience what PPE really means?
Absolutely. So it's personal protective equipment. And for us, that means any device or article of clothing that we wear to prevent the spread of illness, again, among patients, or from patient to provider, or from provider back to patient. That takes the form of many things. The most common things you'll see us wearing are the surgical masks, which we always wore when we did procedures, as you can remember probably from residency, Dr. Shinsky, as well as what we call the so-called elusive N95 masks, which have been so hard to get our hands on, but we have been fully stocked thanks to our leadership at Robert Wood Johnson University Hospital, Somerset, with N95 masks. Takes the hair coverings, plastic or paper gowns, gloves, shields, goggles, but everything to protect the provider so we can confidently take care of our patients.
Well, it's not only the providers, it's the nurses, it's the people who are cleaning the rooms afterwards. It's the dietitians who are coming in. It's not just the providers. The nice thing that the leadership at RWJBH has done, not only at Somerset Hospital, but throughout even the outpatient settings as well as the other facilities, is ensure that everyone is well protected.
Mm-hmm. I agree.
And
Every staff member, I think, feels a sense of safety and security that our leadership is watching out for us.
we have, again, as you had talked about, at RWJBH Somerset, there was the separate entrances. The same thing was done at multiple sites, private sites also. The masks that are distributed when the person comes into the emergency room, again, to protect for the provider, protect the patient also. The fact that you have the separate treatment areas, as you had described, the different acuities, as well as the extensive cleaning, disinfectant that's being done prior to the patients coming in, as well as after they're coming in, and ensuring that anyone who comes in contact with the patient is maintaining personal hygiene, ensuring that they are washing their hands with soap and water prior to touching anything, as well as soon as they're finished doing any examination.
Exactly.
So, important things that the audience needs to know. Now that we are doing such a good job, now that we're welcoming everyone back, ensuring that the acuity of care is being taken care of and avoiding them becoming more severe, what are the typical symptoms that the audience should know about where they should go to an emergency room, such as RWJBH Somerset Medical Center?
Dr. Shinsky, you and I have talked about this for years on prior programs about, what are the things that should trigger that survival response for folks to come back in to the hospital or come to the emergency department at any time. And those are things like chest pain, shortness of breath, loss of function, loss of vision, high fever that can't be controlled at home, weakness that is greater than what you might expect from a normal illness, cold or flu, all those things among many others. But I think those symptoms, and I've always kept it very broad, as you know, I'd rather have patients come to the ED to be reassured by us that they're okay than have them wait at home with something so terrible that we can't reverse it by the time they get there.
So if you think you need the emergency room, now is the time to go to the emergency room. Don't delay. Get in there.
Precisely. And I mean, obviously, folks like you have done a great job in the outpatient setting, triaging patients appropriately. So we still rely on our primary care network through Barnabas Medical Group to get patients to the right level of care. And we're going to continue to trust you to do that, Dr. Shinsky. But, when it comes down to that fight or flight response that people get where they really have that survival instinct triggered, I want them to know that they can come to the emergency department anytime. And that's why we are there 24/7, 365.
And we've done such a good job with separating, cleaning, disinfecting that people need to understand. It's like it was in January, that if you think you have an emergency, if you've got chest pain, if you've got shortness of breath, or if you have any signs or symptoms of stroke, which Laura will talk to us about in a minute, get over to the emergency room, because if you get there as quickly as possible, we could possibly reverse before there's any pathology or anything serious turns out. So let's focus on stroke. Laura, do you want to tell us a little bit about stroke? And Dr. Milano, if you want to chime in, that's fine also. But let's talk about stroke.
No, Laura is truly an expert. So we'd love to hear everything she has to say because she's always teaching us about stroke.
Yes. So thank you so much. So yes, a stroke is considered, it's a sudden interruption of blood flow to a part of the brain, whether it's from a blood clot or a ruptured blood vessel. This interruption can cause a focal deficit, which means the person is unable to use a specific part of the body. So it is a medical emergency. We all know that chest pain, if somebody's got chest pain, that you need to come to the hospital right away. This is the same thing for stroke. So it is a medical emergency. We're not to ignore these symptoms, and you need to get to the hospital right away.
And what are the signs and symptoms that someone should think about, or actually they may not know it? It may be their caregiver, their wife, their husband, even their kids. The signs or symptoms that someone may see that think that they need to think about when someone's having a stroke.
Yes. So a stroke happens suddenly. So it could occur when you're talking to somebody. It could be witnessed onset, but a stroke can also occur when you're sleeping. So if you go to bed normal, feeling fine, and then you wake up with a deficit, that could also be considered a stroke. And it's very important to get here right away. The acronym that we educate is Be Fast. Two meanings behind it. Get to the hospital right away, act fast. But B fast stands for balance, sudden onset of balance disturbance. E is for eyes, any visual disturbance that could happen suddenly. Face is for spatial droop, weakness in the face. Arm, A is for arm weakness, especially on one side of the body, and leg weakness. S is for speech. You could have difficulty speaking, whether it be slurred or garbled or no speech or inappropriate speech. If any of these symptoms happen suddenly, it's time to get to the hospital. So T stands for time. So Be Fast is the acronym that we educate.
And in fact, it's so important that that's even included in the basic life support BLS courses that many of us take. So it's very important. And the reason why it's so important that someone knows about this and gets the person to the emergency room is?
Well, the reason why you want to get here quickly is because we can offer medication to potentially reverse the symptoms. It's very time-sensitive treatment when you have a stroke. Every minute you're having that stroke, about 2 million neurons die. And every hour is equivalent to losing about 3.5 years of age. So it's very important to get here right away. We can offer a medication that can be safely given within 4.5 hours of those symptoms starting. And if they arrive outside of that window, it's just not safe to administer that medication. There's also a surgical treatment called a mechanical thrombectomy, where they can actually go in and potentially remove the clot on certain types of strokes. That window is a little bit bigger. It's about 24 hours, but it's still very important that patients get here right away so we can determine what kind of stroke you might be having.
So again, it's the Be Fast. The acronym is very important. The other thing is to get to the emergency room as quickly as possible. If we can
Right.
get them there within that 4-hour time frame, that Dr. Milano and his team can get someone intravenous medication to hopefully reverse the stroke process. Because if we can reverse the stroke process, we can avoid the long-term effects of a stroke if it's not treated. And those long-term effects are?
Well, stroke is the leading cause of adult disability right now. It's the third leading cause of death in the United States. So long-term disability is an issue. It's a concern. The longer you go untreated, the more permanent your deficits become. So it's very important to come to the hospital, make sure that we can examine you and, offer treatment if you're a candidate for it.
And again, we want to avoid the person long-term having problems with their vision,
Right.
problems with part of their face no longer being able to move. With that, the inability possibly to be able to speak clearly. And even worse is we want to avoid part of one of their limbs, either one of their upper or lower limbs, not be able to move, that they become basically a disabled American. And so
Correct.
again, with the guidance of you as well as Dr. Milano and his terrific team at RWJBH Somerset Medical Center, we can hopefully help prevent this from becoming long-term for a patient.
Absolutely.
Correct. Yes, we definitely always talk about deficit versus disability. You could, someone may consider not being able to move their arm very much be a mild disability. But if that affects your lifestyle and if that's going to alter your quality of life, it's very important to take it very seriously.
Now, Dr. Milano, you've also helped establish Robert Wood Johnson University Hospital Somerset as having teleneurology services. Again, something as part of all of this. What is teleneurology and how does that work at RWJBH Somerset Medical Center?
Actually, I think a great way of describing it would be to walk you through what happens when we have a so-called coach stroke patient come into our emergency department. And it really hopefully starts prior to arrival. And that's why I think I'd want to also remind the audience that, if you think you're having a stroke, it's best to call 911 and activate the emergency response system. That way you can get there the most promptly. And in fact, when you come by 911, when you come by ambulance, we get a call ahead, which allows us to start preparing the emergency department for your care, especially even in the age of coronavirus. Having those protections in place is even more critical. And we can make sure that every step in your pathway is clear and clean and ready to roll, number one. The second thing that will happen is I'd like to call it this sort of beautifully choreographed medical ballet that happens when a patient arrives with a stroke. And it's really this swift lifting of the patient through the process. In fact, many patients who come by ambulance have a very brief pause in the emergency department to be evaluated by myself or one of my colleagues. And then they're whisked off to the CT scanner, which is clean and sanitized, where they receive that stat or that rapid CAT scan, that brain scan to tell what kind of stroke, as Laura alluded to, that they're having. Once that's completed, they come back to the emergency department to be evaluated immediately by a telehealth neurologist or a teleneurologist that performs an extensive evaluation using a robot assisted by our nursing staff and Laura and her team to evaluate the patient's problem, the deficit, so to speak. What is it that's not working? Is it the speech? Is it the coordination? Is it the vision? To derive a score for the level of deficit and then determine what treatment should be offered to the patient. And I won't jump too far ahead, but that's sort of what the process of coming into our center for a stroke looks like. And in fact, this is really shocking, but many patients and families who've come to our emergency department during the course of a stroke are those that are most likely to come back and say, thank you for all you did. Even though they went through such a terribly frightening experience, they are so overwhelmingly impressed by the speed, the coordination of the care that they receive, that they often come to show us their appreciation for that.
Wow. Well, that's the whole idea of why RWJBH Somerset Medical Center exists. The fact that we also are a primary stroke center. And Laura, do you want to tell us what that really means?
Sure, yes. So a primary stroke center is a hospital that has the resources and processes put in place by the American Heart Association and Stroke Association to offer the best care possible for a stroke patient. So we are a Joint Commission certified primary stroke center. We have these standards in place and these metrics in place in order to offer good care and promote best outcomes for our stroke patients. I'm proud to say we've won awards for our stroke center. This year we will be awarded the Gold Plus Target Stroke Honor Roll Award, which is an initiative put out by the American Stroke Association to they help to raise the bar and set targets as far as our treatment times and patient outcomes.
So in other words, RWJBH Somerset Medical Center, which is a small community hospital, is a primary stroke center, and we're on par with large university medical centers throughout the country and have achieved standards and
Yes.
even did better than many of the other university centers at stroke and at the treatment of stroke.
Yes.
So
Yes.
if a patient is concerned, they have no concern coming to RWJBH Somerset Medical Center. They are getting excellent care. That is, even the government even says we've achieved excellent care.
That's absolutely correct. We have, I am part of the Robert Wood Johnson Stroke Collaborative. All the stroke coordinators meet routinely and share best practices in order to offer the best care for our patients. We have a very close relationship with our mobile health services, and pre-hospital care for stroke is unprecedented, I believe. There's legislation out there now that requires our mobile health services to do a stroke scale in the field to determine what potentially the stroke is, what kind of stroke the patient's having, and it helps them to designate whether they need to go to a primary or a comprehensive center. And we are densely populated with stroke centers in this state. So it's an excellent state to have a stroke in because there's a lot of stroke care, and there's Robert Wood Johnson Somerset is the place to come if you are having a stroke.
And Laura has started to, I think, emphasize something that I want to make sure we drive home too, is that, yes, we are a community hospital. We can provide state-of-the-art care, but we provide that personalized family environment for our patients that I think also makes them feel very comfortably. But the other important thing to remember is that we do have an intimate connection with Robert Wood Johnson University Hospital in New Brunswick, which is a comprehensive stroke center that can provide all of the advanced and more invasive care that's needed by some stroke patients. So we're able to get patients transferred to that center if they need to be incredibly rapidly.
So again, we are ourselves a primary stroke center affiliated with a comprehensive stroke center that's also part of the same system. So leadership understands the whole process and has put this together, of course, with your backing, Dr. Milano, and Laura's backing, and the fact that we meet all government guidelines and we've got it set up so well. And yeah, it's very sad when someone does have a stroke, and we're not saying that having a stroke is good, but what we do know is that if you think you are having a stroke, first thing to do is to call 911, because this alerts the system that something severe is coming in. They can then call Robert Wood Johnson, RWJBH Somerset Medical Center, alert the primary stroke center that someone is coming in who possibly has a stroke. Assessment is done as quickly as possible. CAT scan is done as quickly as possible. Treatment is done as quickly as possible. And hopefully long-term effects of a stroke we can keep to a minimum. And all done in a community hospital, which, as you stated, is very important because now, of course, during the COVID pandemic, it's very hard for family to be brought in because right now we can't do that yet. That will be relaxed as we get more and more through this curve, but at least they're in the community that they grew up in, so that if they need any outpatient services, it can be done close to their own home, and their own family can help them with it also.
Yeah, that's a great point, Dr. Shinsky. And we've made incredible efforts to virtually bring families to the bedside in this time of crisis. We've pioneered some telehealth solutions to allow patients and families to still communicate with one another, despite the fact that the families have had to remain outside the hospital We've utilized our palliative care team services to help make that process much less painful for families and guide them through harder decisions that they would like to be at the bedside to make. But I think we've done a lot to leverage technology and just the human touch during this crisis to try to bring families into the hospital, despite the fact that they can't physically be there.
So again, we give them excellent care. The government even says that we give them excellent care through all of the metrics that Laura had described. We've got this terrific leadership for RWJBH Somerset Medical Center, as well as the whole system itself. And we've got the leadership right there in front of us on our Zoom cameras, the emergency department head, as well as the coordinator for the stroke. And we know that we are giving them terrific care. We have a primary stroke center as part of RWJBH Somerset Medical Center, with the ability to transfer or even do telehealth to RWJBH in New Brunswick, which is the comprehensive stroke center, if needed. Hopefully not needed, but if needed, we have them as a backup.
Exactly.
So last thoughts for both of you. Dr. Milano, what would you like the audience to know?
We're here for you. We're going to continue to be here for you. We don't want you to wait at home, getting sicker and sicker and sicker, winding up with a problem that we can't reverse. We are safe, and you'll be safe. You won't overwhelm us, and that's why we're there.
And Laura, last thoughts from you.
I agree. We have seen our stroke volume decrease during this time, and it's awfully sad. We had a patient come in this week who was weak on her left side and decided to go to bed, and she woke up in the morning and was still weak. She didn't want to come in, and she does have a stroke. So it's very important. Please do not ignore those signs and symptoms, and please call 911 and get here right away.
Can you give us that acronym one last time?
Sure. The acronym is Be Fast. I have a little prop here. Be fast, balance, eyes, face, arm, speech, and time to call 911. Okay?
Thank you. Thank you both for being here, and thank you for everything you do on at the first line at RWJBH Somerset Medical Center. Thank you for all of your time, effort, and what you give our patients.
All right. Thank you, Dr. Shinsky. Thanks, Laura.
Thank you so much for having us.
This concludes today's episode of Robert Wood Johnson University Hospital Somerset's Health Talk. Please remember, the opinions expressed here by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call our physician referral line at 888-724-7123. For more information about Robert Wood Johnson University Hospital Somerset and the safety precautions in place at our hospital, please visit our website at www.rwjbh.org/Somerset.